From the nation's capital, Eye on Washington with Marilee Joyce. A weekly discussion about the federal issues most important to Nevada. And now, from Washington, D.C., here's Marilee Joyce.
And good day to you. I'm Marilee Joyce. This is Eye on Washington, the only statewide Nevada news program produced in Washington, D.C. Every week, Eye on Washington takes you straight to Capitol Hill for a discussion with Nevada's delegation and other leaders about the federal matters that matter to you. Today's topic, his prescription for what ails Nevada's healthcare system. We're going to learn what one Nevada healthcare leader says needs to be done to improve healthcare in Nevada and nationally. And that healthcare leader is my guest today. He is Dr. Tony Slonim, the president and CEO of Renown Health. Thanks for being here.
Thank you, Marilee.
Appreciate it. Well, did you know that today the average American spends $10,000 a year on personal health care costs? And today on Eye on Washington, we'll learn why higher costs don't always translate to higher or better care. We'll tell you about Nevada's low rankings in some very important healthcare areas, and we'll learn how my guest is working to improve those numbers and hence the health and well-being of many of you watching and listening today. Despite the fact that more Americans have access to healthcare today, cost and service quality vary widely from state to state. That's according to an article posted in August on the website Wallet Hub, which reveals that Nevada is faring poorly in several key areas. Overall, for healthcare in general, Nevada ranks a not-so-healthy 42nd. The Wallet Hub study looked at 13 areas and rated states on three key dimensions: cost, access, and outcomes. Cost refers to the cost per visit, as well as monthly insurance premium and monthly out-of-pocket spending. Access means 18 components ranging from number of insured to quality of the public hospital system to average emergency room wait time, while outcomes means a host of results-related things like infant mortality rate, readmittance rate, heart disease rate, and much more. And Nevada ranked poorly for cost and access, 47th and 50th, was better for outcomes at number 28. Dr. Slonim, welcome to Eye on Washington. I want to get to Renown's efforts to be a leader in turning around these lousy statistics. But what I want to start with now is kind of to look at Nevada's just overall rankings in the study. I want to start with your thoughts on that overall 42nd ranking and why you think this is so.
Yeah, you know, Marilee, there are so many challenges that we have to healthcare in Nevada. And when we've been talking now for, more than a decade about the value proposition in healthcare, which is the relationship between the quality and the cost, what you know is that, unfortunately, the value proposition in Nevada is upside down. Our quality isn't so good, and our costs are really high. And we have to continue to work to undo that conversation.
Why is the state so high for cost? You know, the study mentioned, among other things, cost of visits, out-of-pocket spending.
There are a number of reasons. I think it goes to the point that, in fact, we're not as healthy as we ought to be. And with lack of more visits, presentations that are later in the course of an illness or a disease, which means that people require more and more care. That's that much more expensive. We know that for many, many years, our gaming industry has really, promoted the issues of smoking and gambling and addiction and those kinds of things. Not so healthy eating, all the lifestyle choices that you make. And so I think that those are all components of the bigger problem.
You know, I should point out that Washington, D.C. was included. So 50th is only second worst for access, but it's still pretty lousy. Right. Lack of access, though, does mean lack of care for a lot of people. How do we improve access to care, and what's Renown doing there?
Well, a couple of things. I think, there are certainly challenges, and people will try to make this conversation an insurance conversation. Insurance is certainly a part of it. And in Nevada recently, we've had some real challenges with markets that were bare, uncovered by insurance companies, particularly in our rural arena. And that leads to problems of its own. But make no mistake, even though Nevada has done a wonderful job as an expansion state, opening up Medicaid rolls for people who may not be able to afford insurance, that's not the end of the story. many physicians won't accept Medicaid. So just because you have a Medicaid card or a ticket, it doesn't let you get into the game.
What areas of low ranking are you and Renown most concerned about right now? What are you most focused on there?
Well, you know, it's funny. We started, when I got to Renown about 3 years ago, I had the great privilege of being able to create a new strategic plan. There are 3 pillars in it. The first pillar is focused on quality, service, efficiency, and access for all. We call that the triple aim plus access in common parlance in our organization. But it really does try to hit those major issues of how we can improve the healthcare of Nevadans.
And when we return, Nevada's failing healthcare areas and what my guest says needs to happen to bring those rankings from worst to first. That's just ahead.
You're watching Eye on Washington with Marilee Joyce, brought to you by Caesars Entertainment, the Regional Transportation Commission of Washoe County, the Las Vegas Sands Corporation, the Las Vegas Convention and Visitors Authority, NV Energy, Jim Marsh Automotive, the Rogich Communications Group, and Renown Health.
I have 3 tests next week. I'm going to be studying all weekend. Ugh. Are you studying tonight? We can meet up and study together. Oh yeah, that sounds good. What time? I work until 6. Okay, sounds good. Just text me after. Okay. No!
There is no text, tweet, or call that's worth a life.
One pedestrian death is one too many.
Look up.
And look out for each other.
Want more federal news that affects Nevada, its businesses, and its residents? Then you need to subscribe to Nevada's Washington Watch newsletter, your sole source of online news direct from Washington, D.C. Visit joycecommunications.com and subscribe today.
Planet Hollywood, Paris, Harrah's, Caesar's Palace. It's one of the most exciting skylines in the world, Las Vegas. Caesars Entertainment has nearly 50 casinos worldwide, including these. But no matter which casino you visit, we want you to play responsibly. And if you need help setting or keeping a limit, we hope you'll call this number. You see, we know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
A family's presence in the hospital helps children heal faster and cope better. But children who need specialized medical care are often sent out of the Reno area for treatment. Costs can get unmanageable, and it can be difficult for families to accompany their sick child. The Travel for Treatment program, presented by Ronald McDonald House Charities Northern Nevada, gives parents travel assistance when a child's medical treatment is not available at a local hospital. Please contact us today for more information and to see how you can help. Donate online at rmhc-reno.org.
And welcome back to Eye on Washington, our discussion of top healthcare issues impacting Nevada. My guest today is Dr. Tony Slonim, the president and CEO of Renown Health. Well, let's spend this segment looking at 4 healthcare areas where Nevada ranks particularly low, and then find out what our guest says needs to happen to improve those areas. We've discussed the doctor shortage in Nevada on Eye on Washington previously, so it should come as no surprise to this audience that Wallet Hub piece ranks Nevada 49th for the number of physicians. And even if you can get a doctor, if you wanted that doctor to treat you in a hospital, you might be out of luck. Nevada is 50th per capita for hospital beds. Another worst kept secret for anyone following the news is Nevada's low ranking for individuals having health insurance, but Wallet Hub breaks it down. The state is 49th for uninsured adults, but dead last at 51st for insurance for our kids. Dr. Slonim, I'm sure as a top Nevada healthcare leader, you're always dealing with that insurance battle. Why do you believe the state for so many years has been so consistently low for insurance for both adults and children? And what, in your opinion, needs to happen to up the coverage numbers for both adults and kids?
You know, Marilee, our state is a really interesting place to be. The geography is very, very broad, and I think that plays an important role in the conversation. You know, you have 2 major urban-suburban hubs in Las Vegas and Reno, but the geography is much more broad than that, and the vast countryside that we have, you know, right on the frontier, the difficulty in getting to people and having them have proximity to good healthcare services and have doctors who are interested in practicing in those arenas is also challenging.
So you're saying that the challenges to urban and rural areas are very different, and we're seeing even a greater need for healthcare access in the rural communities.
Absolutely.
Well.
We know how challenged our rural communities are, and it's a big problem that we need to help and support the people who live there through their community resources, whether they're hospitals or physicians or other healthcare resources.
Yeah, speaking of physicians, you know, it's a component of access we've talked about many times on this program. Nevada remains in great need of physicians. It's severely short, both generalists and specialists. How severe is that now?
It's quite severe. We have some amazing and very well-trained physicians in our community. They do a great job every day caring for the members of our community. But what we know is that we don't have enough. And so a couple of things have gone on in the state. There's a new medical school at the University of Nevada, Las Vegas. There's actually another new medical school down there, and the University of Nevada, Reno is helping to keep our students in the north. We're so excited to be a major strategic affiliate with them, creating programming so that the medical students get educated, and more importantly, graduate medical education programs that keep those residents in town.
You know, a couple of years ago, I had former Nevada Congressman Joe Heck on this show, and unfortunately, his bill was not enacted, but he had legislation aimed at creating a grant program that would fund residency programs. The idea being that people stay or return to practice in states where they complete their residency. That, on a federal level, when you and I talked before the show, you were saying that was needed, but you were really singing the praises of our governor, Brian Sandoval, for some work along this line.
Governor Sandoval has done a number of great things on the healthcare front, including expanding access, but also his support of graduate medical education at the university, particularly in that area that you highlight, which is residency programs. And in our partnership with the University of Nevada, Reno, we have been successful in getting a couple of new programs up and moving. And that's going to help us in the long term. It's relatively speaking, in government terms, a minimal investment for a really good long-term outcome.
Have you seen this alliance with UNR, this work by our governor, and these other efforts to keep the resident physicians, et cetera? Have you seen an increase in physicians, even incrementally, since you've come on board?
I think it's a little bit too early to tell. What we have noticed, though, is that we at Renown Health are hiring more graduates from our residency program, which we didn't see in the past. And so that's exciting for us, that the partnership that we stewarded together actually leads to graduates who want to be employed and want to stay in the community. We're seeing some of that. It's a little too soon to tell. They're not of the magnitude that you would hope will make the difference.
You know, we're running out of time on this segment, but, you know, some stats that I cited in previous show. Nevada is 40th for OBGYNs. This is out of the 51. 46th for both family practice doctors and physicians. 50th for both psychiatric physicians and registered nurses. 51st for orthopedic surgeons. I could go on. What are you and Renown doing to kind of attract those specialists?
Yeah, there's no doubt that we have to make sure we're hiring and working with our community doctors to recruit effectively specialists into the community. We're firmly establishing a primary care base, which helps, but we're also reaching out. We've also got a partnership with Stanford University to help us train their specialty physicians who come to Northern Nevada to Renown Health and provide services when we need it. That partnership hopefully will help us to attract over the long-term specialists to our community.
That's great. Okay. And when we return, the delegation's recent healthcare efforts and Dr. Slonim's partnership with our congressional leaders. We're going to have that for you right after this.
Nevada's direct link to Capitol Hill. Eye on Washington with Marilee Joyce. The only statewide Nevada news show based in Washington, D.C. All the top federal matters that matter most to Nevadans. Marilee talks with our congressional delegation and other leaders about the federal news you need to know. Eye on Washington with Marilee Joyce. Nevada's Eye on Capitol Hill.
When you think RTC, what comes to mind? How about jobs? RTC road projects bring thousands of jobs to Washoe County. Expanding, and connecting Northern Nevada, growing our local economy, providing a more secure future for our residents and their families. So when you think jobs, think RTC. Your RTC, the RTC of Washoe County.
We're not a miracle drug. We're not a technology. We're not doctors. Just the hope, which can often be the best cure of all. The Ronald McDonald House, a home away from home for seriously ill children and their families.
Planet Hollywood, Paris, Harrah's, Caesar's Palace. It's one of the most exciting skylines in the world, Las Vegas. Caesars Entertainment has nearly 50 casinos worldwide, including these. But no matter which casino you visit, we want you to play responsibly. And if you need help setting or keeping a limit, we hope you'll call this number. You see, we know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
Did you know parking over tall, dry grass can spark a wildfire?
Only you can prevent wildfires.
Safety. We all think about it. You think about it when he buckles in, when you check your mirrors and put away your phone. RTC thinks about safety too. In fact, we create it. Center turn lanes mean fewer blind spots. Bike lanes keep cyclists and you safe. Roundabouts reduce injury collisions. And all these crosswalks are designed to keep families like yours safe. Safety is your priority, and it's ours too. Every day, in everything we do.
And welcome back to Eye on Washington, our discussion of healthcare issues that matter most to you in Nevada. My guest today is Dr. Tony Slonim. He's the president and CEO of Renown Health. Well, when it comes to strengthening Nevada's healthcare system, our Nevada congressional delegation is taking a multifaceted approach, offering legislation dealing with a wide range of issues. Let's look at just a handful of their recent work now. Senator Heller is co-sponsor of the Healthcare Tax Relief Act. It delays Obamacare health insurance tax for 1 year in an effort to prevent higher health insurance premiums. Congresswoman Rosen is co-sponsor of the Marketplace Certainty Act, which addresses market instability by controlling costs and helping to keep insurers from exiting the Silver State Exchange. Both Senators Hellers and Cortez Masto are focused on funding for community health centers, and both Senator Cortez Masto and Congresswoman Titus are working to improve health care for female veterans. Congressman Amade has been on this show telling us of his work to protect thousands of Northern Nevada military retirees and their families from changes to TRICARE Prime. And Congressman Kewin is working to get needed grant funding from the Department of Health and Human Services for rural health care for his District 4 constituents. Dr. Slonim, I know that you are sometimes here in Washington. I'm sure sometimes you're meeting with our delegation. When you're not, I'm sure you're on the phone with them and their staff. I wanted to know, how do people like you, how do top healthcare leaders in Nevada, how do you partner with the delegation when it comes to pushing for federal healthcare that benefits Nevadans?
I'll tell you, the most remarkable thing I've learned and enjoyed about being in Nevada is, despite how vast we are in terms of geography, it's actually really a small state. And when you build relationships with people, it becomes comfortable to be able to pick up the phone, drop them an email. Because it's such a small community, we run into each other at events all the time.
I get told that a lot.
A lot. Yeah. And, just recently we were at a great dinner raising funds for the Tahoe Fund. And sitting next to me was the governor, and Senators Cortez Masto and Heller were across the table. And so it's that kind of an environment.
And kind of a captive audience for your
totally.
Senators, here's what we need in healthcare, right?
Exactly.
You mentioned rural health care and the importance of it. And rural health, it's a big issue in Nevada. It's one we've covered many times on my program. And as I mentioned, Congressman Kewen, about his leadership in trying to get needed health care funding to those rural areas. What, in your opinion, are the top needs of the state's rural areas, and what needs to happen on the Hill to improve health care in those areas?
I think as we go about democratizing healthcare, making it available to all, we need to be careful and understand about what we can afford and what's appropriate from an innovation perspective. The way of healthcare in the future, which is what you get when you're sick or injured, is different from how we promote health more broadly. And you don't need hospitals necessarily to promote health, yet people in the rural environment, we worry about them when they don't have a hospital in their community. So we have to overcome our own prejudices about what does the structure of health and healthcare look like as we go about rationalizing the delivery of services in the rural environment.
What are some of the things you, on a federal level, what are some of the issues right now that you and Renown are most concerned about? And if you had the ear right now of Nevada's whole delegation, which hopefully they are all watching and listening to this program statewide, if you had their ear right now, what would you say needs to be done for healthcare in Nevada?
Well, I think in Nevada, certainly we are the subject of a lot of attention as it relates to the rural environment. Access is key for us. And I think that we want to make sure that as an expansion state, we continue to be able to put people, we've talked here about the limitations we have with people getting access and insurance. That's really important. And we need the state.
What's the role of the federal government there?
I think the role of the federal government is to help us to make sure that we don't create limitations to the people that we've already given access to. And those subsidies that are coming to the state are very important. In addition, we need the state to maintain its flexibility. No two states are the same. And so having the federal government give us the leeway to be able to assure that those on the ground who understand the context in which we're working can really put in place the best programs that are innovative and drive to better quality and cost. We certainly need that.
Excellent. And when we return, how is my guest making Renown live up to its name? I'm going to explain right after this.
Planet Hollywood, Paris, Harrah's, Caesar's Palace. It's one of the most exciting skylines in the world, Las Vegas. Caesars Entertainment has nearly 50 casinos worldwide, including these. But no matter which casino you visit, we want you to play responsibly. And if you need help setting or keeping a limit, we hope you'll call this number. You see, we know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
Nevada's direct link to Capitol Hill. Eye on Washington with Marilee Joyce. The only statewide Nevada news show based in Washington, D.C. All the top federal matters that matter most to Nevadans. Marilee talks with our congressional delegation and other leaders about the federal news you need to know. Eye on Washington with Marilee Joyce. Nevada's Eye on Capitol Hill.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Are you studying tonight? We can meet up and study together.
Just text me after.
Okay. No!
There is no text, tweet, or call that's worth a life.
One pedestrian death is one too many.
Look up.
And look out for each other.
This girl is very pretty. It's inciting feelings of jealousy in me. We should pick on her.
I'm insecure about some things, so I think we should put some me stuff on here. Maybe even some lies, too.
Yeah.
I just want to be accepted by you both. So I'm going to send this to my friends so they think I'm cool.
Kids bully for all kinds of reasons. None of them are good. Find ways to get involved at flipthescriptnow.org.
Want more federal news that affects Nevada, its businesses, and its residents? Then you need to subscribe to Nevada's Washington Watch newsletter, your sole source of online news direct from Washington, D.C. Visit joycecommunications.com and subscribe today.
And we are back with our closing segment of today's Eye on Washington, and we've had as our very special guest today Dr. Tony Slonim. He's the president and CEO of Renown Health. As we close today's show, I wanted to let my guest tell us just a bit about himself and the unique philosophy he has brought to Renown Health and hopes catches on in healthcare generally. I mentioned before the break he wants the reputation of his hospital to live up to its name. Well, Merriam-Webster defines renown as the condition of being known or talked about by many people, or fame. Well, Dr. Slonim is working hard to make sure that people have nothing but great things to say about Renown Health. And Dr. Slonim, you know, before this show, I worked with your staff. I learned a lot about your very unique philosophy and about many of the things you're trying to do to improve the quality and care, not only at Renown, but also kind of spreading your healthcare philosophy in the state far and wide as far as you can get it, right? I wanted to look at some of those areas, starting with your very unique blog. You have a very people-first focused approach there. So start with that. And you kind of want to talk about the blog. And
Yeah, Marilee, we are doing some, I think, important work. Not only when people are sick or injured, they want to have someone caring for them. I know this firsthand. I'm a cancer survivor myself. And the things that were important to my providers when I was sick and they were caring for me weren't actually the things that tracked with me. I was worried about my children. They were young at the time. I was worried about what the future looked like. And so while my team was focused on restoring me to my physical health, they didn't fully comprehend my dreams, my aspirations, my ambitions, and my concerns in a way that were important. And so at Renown Health, we're trying to put people before patients as a way of understanding. If you engage with people, you can really start to get into who they are and what they want out of the experience of health and healthcare.
Tell us about some of the subjects you've had on these the blogs that you're sending out.
Well, we talk quite a bit about the whole person. We talk quite a bit about living healthy. For some people, all you can do is, go for a walk or have a good meal. And we shouldn't restrict people from living out those aspirations, particularly if they're at the end of life. People too often will put restrictions on people because you shouldn't smoke cigarettes if you have lung cancer. Well, as you're coming to the end of your life, that may be the only thing that gives you solace.
It's beautiful. I hope a lot of people are hearing it. Thanks so much for being here today.
Thank you, Marilee.
That does wrap up this week's Eye on Washington show. For more information on any federal issue that impacts you in Nevada, please visit our website, joycecommunications.com. Be sure to like us on Facebook and follow me on Twitter, and catch up with any shows you may have missed on our YouTube page. Thanks so much for joining us today on Eye on Washington. I'm Marilee Joyce in Washington, D.C. Have a good day.
Thank you for watching Eye on Washington with Marilee Joyce. Eye on Washington with Marilee Joyce airs statewide in Nevada solely due to the generosity of our sponsors. If your company can support our program, please visit joycecommunications.com/sponsor to learn more about becoming a sponsor today.